COVID cases right now are on the rise across the country and right here in Indiana as the kids go back to school.
In fact, when you do a number-by-number comparison, this is hard to believe, but we are seeing more reported cases now in central Indiana than we were at this time last year when the vaccines weren't even out. Also, the number of people in the hospital and the people that are in the ICU in central Indiana also growing quickly. We're starting to see more people show up as well to go get tested for COVID. So look at the line here. It's been a while since we've seen lines like this one. These images taken earlier today in Fishers, and now some are predicting all the numbers that we mentioned are going to continue to go up.
Yeah, Dustin Grove explains why.
On a sunny day outside IU's Methodist Hospital, Nurse Carrie Malloy says the mood inside is anything but.
I am disappointed. It's like a repeat from 2020's April when we just filled up.
Across the state, nearly 3 times as many people are now in the hospital with COVID than last month. The number of patients in ICU quadrupled.
I just can't believe that people didn't see what happened the first time and now it's happening again. But why? We had a way to prevent this.
On CBS's Face the Nation this week, former FDA Commissioner Dr. Scott Gottlieb called out Indiana specifically, saying cases are building here, along with Illinois and North Carolina. And the challenge right now is that the infection is going to start to collide with the opening of school.
Everyone thought, we're done. This is over. We're done with this. And we don't need to do this. And we're encouraging you to think very, very seriously about, yes, follow the guidelines, follow the guidelines.
Hospital administrators call it a perfect storm of challenges right now. An influx of patients in need of care, and too often a struggle finding enough staff to provide it.
I've got 4 rooms there and I got 3 rooms here, not staffed.
Last week in Lafayette, Franciscan told us it was down 18 nurses and had to close its palliative care unit because staffing was so short.
Nationally, it's just a challenge to recruit nurses.
And in some cases, he says, a challenge to keep those still there.
We have staff that are just resigning and saying, look, I can't take this anymore. I can't do this anymore.
For now, Carrie Malloy says she's here as long as it takes.
For now, I'm in it. I mean, I can't leave my coworkers now.
Now, the State Department of Health told us today it's not just older adults struggling with COVID-19. Over the last week, 36 kids who are 19 or younger have now been hospitalized with COVID. And the average number of new cases across the country has now jumped to more than 100,000 a day. Hospitals quickly running out of space. In fact, in Austin, Texas, a city of 2 million people, there were only 6 available ICU beds to start this week.
It affects everyone. It affects our management and our ability to care for everyone, not just COVID patients. So it's very stressful.
New analysis from CNN shows 99.99% of vaccinated people have not had a breakthrough case of COVID resulting in a hospitalization or a death.
But when we see these cases go up, we're also seeing a lot of businesses here in central Indiana, and some cities are making some changes as this Delta variant continues to make an impact. For example, the city of Columbus now requiring masks inside its city buildings. In Tippecanoe County, people who show up for jury duty are going to be asked to wear masks. Judges there may also require masks in the courtroom if they can't keep people there socially distanced. Also, as far as one of the largest hospital systems, Community Health Network, making some changes, putting visitor restrictions in place once again. This means that patients are limited to 2 visitors over the age of 18, depending on the type of care and also their location.
The Pentagon now wants to see members of the U.S. military fully vaccinated against COVID by September 15th. That deadline could be moved up if the FDA gives final approval to the Pfizer vaccine before that date. More than 1 million military members are fully vaccinated right now. Another 237,000 are partially vaccinated. Now, if booster shots are approved, you may feel some side effects similar to what you felt with that second dose.
And we're hearing this after there's some new research that comes out of Israel where they're offering boosters to people there who are over 60 years old. Now, the country's largest healthcare provider surveyed 4,500 people a week after their 3rd Pfizer shot. 86% of them said they felt similar or better after the 3rd compared to how they felt after they got their 2nd shot.
And the most common side effect was soreness at the injection site.